Is your treatment for ED not working yet? Today we're going to discuss why, what you can do, and when you should start to see improvements in your erectile function. I'm Stephanie Wolf, PA and CEO of the Novus Center.
And I'm David Dombrowski, the Center Director for the Novus Center. Novus is the nation's leading sexual wellness clinic for men. Over the years, we've helped thousands of men with their bedroom performance and erectile dysfunction. So if you'd like, you can go ahead and skip the video and get a free consultation at thenovuscenter.com, or you can keep on watching.
ED can be caused by many factors. So if you're only dealing with one issue, such as the microplaque that's building up in your blood vessels by maybe using shockwave therapy or the Phoenix, but perhaps you have uncontrolled diabetes or high blood pressure, then you're not dealing with all of it. And similarly, if perhaps maybe you're only optimizing your hormones, but not addressing the microplaque that's building up in your blood vessels, then you're not really optimizing your erectile function.
So we've seen many patients who've tried everything. You know, they've done testosterone optimization, now they're exercising, but they're still not seeing results. Then they make it to the clinic and they end up doing a series of shockwave treatments and the P-shot, and voila, things are working like they used to. Now, did the testosterone help? Yeah. Did the exercise help? Absolutely. But it's very important before you start doing a treatment for erectile dysfunction, you understand what the root cause of your erectile dysfunction is, so you're actually addressing that root cause. The body works together and all of the things need to work in harmony, but you also want to make sure you're addressing the actual cause of the problem so that you can actually fix that problem.
So how do you know what's actually causing your performance problems? Well, that's why it's important for you to seek out a consultation with a sexual wellness clinic, perhaps like Novus, somebody who can actually take a look at everything and find out what exactly is going on. What's going on with your hormones? What's going on with your blood sugars, your blood pressure? What about the microplaque in your blood vessels? We're not looking just to give a Band-Aid or a pill or an injection. We want to actually know what the root cause to your erectile dysfunction is and help you fix it.
Or you can know in about 10 minutes by going to getmyprotocol.com and taking the quiz. It's no replacement for a medical evaluation, but we've done our best to replicate the same questions we'd ask you in clinic. And by doing so, what we're able to do is identify the type of erectile dysfunction that you have and create a custom plan to reverse your unique type of ED. Once you have your own personal plan, you can take it to your local sexual wellness clinic like Novus or your doctor and discuss your options.
So remember, if you're not seeing results yet, perhaps this isn't the first step to treating your erectile dysfunction. Or perhaps it is, and you just need something additional, maybe like hormone optimization. So make sure that you seek out some guidance from your medical professional or perhaps a sexual wellness clinic, or maybe just take our quiz at getmyprotocol.com. We've left clinical studies to the topics we've discussed today in the description below. We hope this video helps.